Hi everyone, welcome to my YouTube channel Dr. SS. I hope everyone has written exam very well, but there are still some controversies to be addressed. In the NEET 2022, almost 30 to 40 controversial questions were there. Let me address 10 questions from them, and the remaining I'll address in the subsequent videos. And you can watch this video in 1.5x or 2x to save your time. Coming to the first question. Younger child presented with pain and hearing loss. The otoscope image is given. Identify the condition. The four options are myringitis bullosa A or otitis media with effusion, pneumotympanum, and the bulging tympanic membrane. The controversy exists between myringitis versus otitis media with effusion, and the question it is given that young child. So in the young child, both myringitis bullosa and otitis media with effusion are common, but the image given in the NEET 2022 is mostly depicting serous otitis media. If you want to see, you can see the image of this myringitis bullosa. The lesions will be bullous. And then coming to the second question, so the answer for first question is otitis media with effusion. Next, coming to the second question, things you will do as a medical officer of PHC when posted in seismic areas. Seismic areas are the disaster prone areas. The four options are: ensure funds and resources are available and can be mobilized at time of disaster for quick evacuation is option A. Option B is preparedness to handle emergency. Option C is disaster simulation practices and then check the response. D is follow the announcements given on loudspeaker. Here option D is correct because it is not done in disaster preparedness, but it is done during occurrence of a disaster. Coming to the third question, a 24 years old female with 18 months baby on breastfed has heavy irregular bleeding on menstruation. What is best contraception advisable? So the four options are Mala N, Progestaset, copper T380A and depot formulation. The controversy exists between all four options. Here in this case, the Mala N cannot be given, that is OC pills cannot be given in undiagnosed abnormal vaginal bleeding is first important thing. Second, Progestaset, yes, it can be given, no contraindications. The third thing is copper T380A. Generally, it is contraindicated in heavy bleeding. In the question, it has mentioned that there is heavy irregular bleeding. And option D, depot formulation. It is used as a contraceptive measure, but it cannot control the heavy bleeding effectively. So the answer finally here is Progestaset. Next, coming to the fourth question, WHO stepwise approach include all except. The four options are physical, psychological, behavioral, and therapeutic. The controversy exists between option B and D. The controversy arises due to the stepwise approach has of the WHO has included three things. One, behavioral, physical, and biochemical. Here, the biochemical term can be taken as used as other terms. So here, biochemical term indicates therapeutic. So finally, WHO stepwise approach does not include psychological thing. It includes physical, behavioral, as well as therapeutic. So that is the stepwise approach. Next, coming to the fifth question, correct about additional nutritional calorie intake in pregnancy. So 300 kilocalories throughout the pregnancy, 400 kilocalories in second trimester, 400 kilocalories in third trimester, 200 kilocalories in second trimester. So the controversy is between option A and B whether to give in second trimester or to give in throughout the pregnancy. But according to the national guidelines, old is additional 300 kilocalories in all trimester and new is additional 350 kilocalories in all trimester. So however, we have to give additional calories throughout the pregnancy, not alone in the second trimester. So the answer is 300 kilocalories given throughout the pregnancy. Next, coming to the sixth question, a child presented with epigastric pain, vomiting for past 10 days with oliguria and features of dehydration. Here the peripheral blood smear shows presence of lymphoblasts. What will be the immediate management? Send for USG, hydration, probin acid, urgent chemotherapy. Here the hydration is the correct answer, but actually the controversy exists between whether hydration or probin acid. So if we go for the diagnosis for the above question is tumor lysis syndrome. Okay, because of the presence of lymphoblasts, we can know it is a malignancy, and the features of oliguria and features of dehydration indicate there is something underlying tumor lysis syndrome is going on. And the immediate management is always aggressive hydration. These are the direct lines given in Harrison. So aggressive hydration will be the method, and instead of probin acid, rasburicase is used most commonly here. But immediate management is always hydration. Coming to the seventh question, a female patient complains of loosening of one tooth and hemifacial pain. Patient was previously treated for COVID-19 4 months ago. Which of the following tests need to be done on priority basis? HbA1c, ferritin, nasal swab for mucor, and MRI head. Here MRI head is the appropriate answer. The controversy exists between whether it is nasal swab for mucor or MRI head. In this case, the diagnosis is mucormycosis. Here in this case scenario, the important step is not to identify the fungus. It is important to know the extent of involvement, because we have to plan for any requirement of debridement, and we should know the prognosis of the condition. So MRI head is most appropriate answer here. And in the question it is mentioned that which of the following tests need to be done on priority basis. So the priority is mainly for MRI head, because even if we diagnose mucor, we cannot do nothing. If we know the extent only, we can plan for the debridement and we can assess the prognosis. Coming to the 8th question. A patient consumed 8 tablets of 0.25 mg digoxin and came with pulse rate of 54 per minute with ECG evidence of third degree heart block. What is the best treatment? Here digoxin immune FAB is the most important treatment. The controversy is between all the options, obviously. Actually here A, B and C, lignocaine, DC shock and phenytoin, they are used in tachyarrhythmias. But in the given scenario, there is bradycardia. So it indicates digoxin toxicity, but does not indicate digoxin induced arrhythmias. So the most specific therapy in this case is digoxin toxicity is always digibind, digoxin immune FAB. Lignocaine, phenytoin used only in digoxin induced arrhythmias. Next, coming to the 9th question, a patient had damage of the basilar membrane resulting in hearing loss of high frequency sound. Which of the following is the location of damage of hair cells? Helicotrema modulus, oval window, and stria vascularis. But the controversy is between 3. I'll explain you. The first option, near helicotrema or apex of cochlea, there will be loss of low frequency sounds. And in oval window, it is a correct option, as the high frequency sounds are perceived mainly here. And option D, stria vascularis, it is present throughout the course, so we cannot specifically mention stria vascularis as the answer. If we see near the round window or oval window, it is 16,000 Hz. Near the helicotrema, it is 500 Hz, and the stria vascularis is present throughout. So stria vascularis cannot be the answer, whereas oval window will be the correct option because it perceives high frequency sounds. Here there is a loss of high frequency sound. The lesion should be at oval window most probably. Next, coming to the 10th question, and criteria for establishing urban community health center to ensure facilities where sub-district or district hospital are not present, referral center for 2 to 3 urban PHCs, for city with 1 to 1.5 lakh population, 100 bedded in metro cities. So the controversy between all options, actually in option A, this is not the criteria, option A. Option B, the referral center is for 4 to 5 PHCs, we have one urban CHC. And option C, almost for non-metro cities, 1 to 2,50,000, 1 to 1.5 lakh population. Non-metro cities, 1 per 2,50,000 population. Metro cities, 1 per 5 lakh population should be there. So among the given option, it is also wrong. And coming to the 4th option, non-metro 30 to 50 bedded, whereas metro 100 bedded. So here it is given 100 bedded in metro cities, which is the right option in this case. These are the 10 questions, controversial questions I am discussing here, and in my subsequent videos I'll update you regarding all other controversial questions and also the number of questions from all the subjects. Thank you.